put the plastic sleeve on. We're going to start with the bite wing. Take your sticker tab and put it in the middle, okay? So you want to be in the middle from this side to that side and from top to bottom. This bit that sticks out, it needs to stick outside of the patient's mouth, so it needs to follow the cable, okay? So you can't put it this way, because if you do, it's going against the cable and it will go into the patient's mouth. So this way, where everything is then following the cable. You then attach this, the red goes with the red, do not use the blue or the yellow, it will not work. You attach the red to the end. And then you then pop that guide on. The guide, regardless of which way you put it, it will work. So the most important thing is to look through it and you can see the sensor, all of it, when you look horizontal. If I twist this and I put it the other way around, it will still work. So for the bite wing, it doesn't matter which way, okay? You get the patient, so everything comes out. So for the right side, this is the patient. Actually, do you want to sit down and I'll practice just quickly on you? Oh, there, no, this was used, no, don't worry, ignore me. So you pop the patient, you get them to bite on this, so this is all coming out, sticking out. And then you put the circle thing, oh, can you do it? To the circle thing like that, okay? That's for the right side of the patient. For the left side, you come around and you switch, okay? So this is for the patient's left, because again, it's coming out of their mouth, and then you hold the x-ray. Again, if you look through, you can see the sensor. So the bite wing is straightforward. Just make sure the sticker tab is right in the middle, okay? And this follows the line, the cable, okay? That's your bite wings. Anterior PAs are also straightforward. Always place the platform where the cable is, okay? So pretty much line to line, okay? So that's where it goes, and it's following the cable. Blue goes with blue. It can only go this way, because if we pop it on this way, the metal will be blocking your sensor. So it can only go to the right side where it's leaving the sensor free. Again, pop this on. And again, this can go either way. The good thing is it doesn't matter. Have a look through, make sure you can see the sensor. So for the upper anteriors, you pop this, this will go against the roof of the mouth. You get the patient to bite and you take the x-ray. For the lower anteriors, you put it into the sulcus, the lingual lock sulcus. Be as vertical as possible. Don't go in like that. As vertical as possible, the patient will automatically tilt it a little bit. Get them to bite and then you take the x-ray. So for your anterior PAs, it's the same. Okay, same as bite wings, straightforward. Right, this is where it gets a bit more complicated. So for your posterior PA, now with the posteriors, we've got the top and the bottom, the right and the left. The upper right and the lower left will be identical. The upper left and the lower right will be identical. Okay, you'll notice that. So if you're ever taking a PA of the upper right and the lower left, you don't need to change anything. But if you're doing the upper right and then the upper left, or upper right and the lower right, you will need to change. So upper right and lower left, so opposites, diagonal will be the same. Okay. So if we're starting with upper right or lower left, what you want to hold the sensor and you want to say, okay, if I'm going into the patient's right side, I want everything to come out. Okay, so the cable needs to come out, not into the patient's mouth. That's the way it needs to go. We want to see the top teeth, okay? So we want to place this sticky tab a little bit lower than the line, because when the patient bites, it will push it up, okay? So just a little bit lower. Again, your yellow metal, gold, will follow the cable. So we're doing the upper right. So you pop that in there. Everything is coming out this way. Now, with this, it's important, there used to be marks on there. It's important the right way you put it so you can see the sensor. So if I put it this way, and I look through, I cannot see the sensor. The sensor is higher up. If I move this and twist it and look through, I can now see the sensor. Can you see the sensor?
Yes.
This is correct. This is correct for the upper right and also the lower left. So if you ever need to do PAs of all of the quadrants, upper right, upper left, lower right, what I do to save yourself time,
Lower left.
Yes.
I do upper right and lower left together exactly crisscross. Then I change it. So this is for upper right and lower left. Then for the other side, I take everything apart. Don't try and change it whilst it's on there because you will get confused. Okay? You will get really confused until you're very sort of used to it. So then for the upper left and the lower right, remember the other side of the crisscross, I want the cable to stick out because this is the patient's left now. Okay? I pop this on there. Again, we're doing the upper left, so we want more of the uppers to be seen. Follow the metal with the cable. So again, it's all coming out. And make sure that when you put this on, you can see the sensor. And that's the upper left done. And then once you've done the upper left, you twist it, and the lower right is ready for you. So if you ever need to take 4 PAs, you only need to change it once. Does that make sense?
Yes.
Yeah? Just make sure when you look through, you can see the sensor. There's nothing blocking it. The platform's not blocking it. The wire's not blocking it. Nothing is blocking it except you've just got the sensor and you've got the tab. That's all you want to see when you look through the platform. Yeah?
Yeah.